Now, we want to do the gliding of the shoulder joint. But guys, before we do the gliding of the shoulder joint, we need to talk about some of the pathology in the shoulder joint that the gliding will be particularly useful for. Among different problems that people have in the shoulder joint, frozen shoulder, rotator cuff impingement are commoner. There could be other problems like osteoarthritis of the shoulder, like dislocation of the shoulder, that we commonly see in orthopedic practice or physiotherapy, but frozen shoulder and shoulder impingements are much more common. So we're going to briefly talk about frozen shoulder. Now, frozen shoulder is a condition that is characterized with painful, passive, and active movements of the shoulder. Basically, in frozen shoulder, all the active movements around the shoulder are painful. The passive movements are also painful, right? It could be caused by problems within the shoulder joint or problems around the shoulder joint, or it could be due to no cause at all. It just developed on its own. But essentially in the pathology, we need to know that the synovial, the capsule, right? The joint capsule that hold the head of humerus with the acetabulum become tightened and less elastic. The capsule become tightened and less elastic. So that each time the patient is trying to do abduction or extension or flexion, that tight capsule is stretched and the patient feels pain. Basically, that is the pathology of frozen shoulder. Okay? It's characterized with painful movements, both actively and passively around the shoulder joint. Primarily due to inflammation of the capsule, followed by fibrosis leading to tightness of the capsule. Now, what do? We have to stretch the capsule. Anytime there's a tight structure, the only remedy to it is to stretch it. And it usually comes with some degree of pain. But at the end of it, the overall pain will be relieved. So that's exactly what we're doing in shoulder gliding. And like I always said, in gliding movements, for the whole of the peripheral joint, the technique is aimed at stretching the capsule. Because if we stretch the capsule this way, we gain movement. If we stretch it this way, we gain movement. So we're going to be doing anterior gliding, posterior gliding, inferior gliding. We can't do superior gliding because the head of humerus will hit the glenoid cavity. Are we clear about that? Yes. Now, before we glide again, there is a concept I would like to revise with you guys. And that's the concept of convex-concave roll. Because if you don't understand it, you will glide in a direction, you won't know the movement you are going to gain. Now, the head of humerus is convex, isn't it? Yes. And the glenoid cavity is concave. So, anytime we're gliding the glenohumeral joint, it is always the humerus that we move. So, we move the convex on concave. And what does the convex on concave rule state? Anytime you move the convex or you roll the convex in a particular direction, gliding will happen in the opposite direction. Do you understand? Or if you glide in a particular direction, movement will happen in the opposite direction. So if I glide this joint anteriorly, the patient is going to gain movement posteriorly, which is extension. If I glide it posteriorly, which is in the direction of extension, patient will gain movement anteriorly, which is what? Flexion. If I glide it inferiorly, patient is going to gain movement superiorly, which is abduction. Yes. So that's the second concept I want us to understand. The third concept, because we're talking about frozen shoulder, and I've said characteristically, all the movements around the shoulder joints are limited, both active and passive. But there's a pattern of movement limitation according to Series, which is called capsular pattern. I've talked to you guys about this. Every joint in the body has a capsular pattern of limitation. When you see that pattern of movement limitation, you know definitely that the pathology has to do with the capsule. And probably you have to stretch. So what is the capsular pattern of the shoulder joint? There will be much more movement limitation with abduction. Abduction will be the most limited due to pain. That will be followed with flexion. Flexion will be more than abduction, but abduction will be most limited. So abduction is most limited, followed with what? Flexion, followed with external rotation of the shoulder, right? Abduction, followed with flexion, followed with external rotation. Extension might be a bit limited or not, a little bit. Internal rotation is always full, or maybe a little bit limited. When you see that pattern, your patient comes and says, now take your hands away from your body and just do that. Pain, so much limitation. Flexion is able to go this much. External rotation is able to go this much. Internal rotation is just like this, despite the pain. That is a capsular pattern for the shoulder. So we know we can use that also to confirm adhesive capsulitis. By the way, the other name for frozen shoulder is adhesive capsulitis and periarthritis. Sometimes it's called periarthritis because it's not osteoarthritis. Yeah. It's taking place within the capsule. That's why it's called periarthritis in some plants. So we need to be clear about this background before we do the glide.